MRI of the brain was done. This is the order for it. Okay, and then this is the PET scan. Okay. Oh, okay. The doctor, the PA in that Athens group called me last week about you. Let me find my.
Okay.
Let's see where we are. It would have been on Tuesday that he called me, I believe. Tuesday. Where is it? Okay, well, I remember this. I'll find the information. I remember it's because the PA that's down there in that office called me. Jason, his name? I forget. I can't remember his name. I have to look it up.
Is it John?
Huh?
Is it John?
John, maybe? Something says
John.
John Carey.
Yeah, that's it. He's the PA there, or the doctor's trying to call me. So they see looking on this PET scan that was done on April 23rd. It was done at Athens Regional.
Right.
Okay, good. They see that there is hyperavid mass in the left lower lung, 3 centimeters. That's probably where it started, right? In the left lung?
Yes,
Is that
ma'am.
what we're thinking? Good. Oh boy. So the good news on this PET scan is that the lungs are relatively okay and the liver looks A-okay. It's the bones that are causing us all the problems. Is that what your understanding is?
Yes.
Okay. They
The
did
bones?
a biopsy. On the right pelvis, the bone,
Yeah.
where they did the biopsy.
Right.
And then here's the bone, right iliac lesion. And the doctor's up to that. And that was on April 29th, so just last week, 2 weeks ago. Okay, so okay, lung mass, lung, GTF, negativity. Okay. Okay, good. And this is April 9th. And is your physician Dr. Ensley down here? Is that who's your general doctor that you see now?
Dr. Rhodes.
Dr. Rhodes, okay.
Dr. Inslee was on
covering.
call.
He was covering. Dr. Rhodes was. Dr.
He was-
Ensley
he
was
was-
that?
he-
Dr.
covering for-
Rhodes was had just had an operation himself,
Okay.
so Dr. Inslee was covering the
Was
hospital.
covering. I see. So he's okay. So you had a you have not had surgery on your lung, have you?
No.
You have not. Okay. This is just the same duplicate of the same report here. Let me see what this one is.
No, it's not.
Some of these reports are the same. The PET scan is the same as it was. It's the same report. This is the same. This PAC report's the
Oh,
same.
okay. Yeah. Because I faxed over
Mhm.
report.
Okay, so you saw John Carey and he did that biopsy, and then dun, needle biopsy found chest wall pain. Okay. Whose paper is this? Let's see. And do you use oxygen at home now? Were they able to put you on oxygen?
Yes, they put me on oxygen.
Okay.
Right.
Oh yeah. Okay, good. So you have oxygen at home now for home use? Okay. Good. Okay. So from a medical standpoint, you are now you're 80?
83.
Wow. Okay. Certainly, you do not show it. Wow. Okay. Good. Okay. Let me ask you a little bit more about your background. Other than this new finding of this lung mass and the issues with the bones that appear to be involved from the biopsy, probably originally from the same lung mass. Do you have any other medical issues?
Diabetes.
Diabetes. Okay. And how long have you been a diabetic?
Well, I found out about it in
November 23rd,
November
2009.
Okay. Okay, good. Have you ever had a stroke or high blood pressure?
No.
No. Okay. Ever had a heart attack?
No.
Sisters, are there any cancers in your family?
No.
No, nobody's been diagnosed with cancer. Do you have brothers and sisters?
I have one sister.
One sister. Is she living?
Yes.
Is she in good health?
I don't know her health status, but
Okay.
she is living.
She is living. Okay. And your parents, what did they pass from?
My mother passed from, I guess, age.
Old age. I was going to say old age is a good scan. And what's going on? The lung doctors, have they shared with you? What's your understanding of what they've shared with you?
What they shared was that the lung mass has grown a centimeter or something like that
In the last couple of months.
in the last couple of months, and that it is traveled to the
bones.
bone right here,
Are you having pain from the bone in the right hip?
in the right hip.
It is causing you pain.
But it was very painful at first, but now it's not as painful, and it's just that it has weakened it, and where the pain mostly now is in here and in the back.
So in your chest and in your back.
Yes.
And what that pain's been there a few weeks, a few months?
It's been there.
April 8th, when you went to the hospital.
About a month.
You went to the hospital on April 8th. I don't know when it started.
Yeah, well, it started. I'd say a couple of days
Okay.
before it started.
Okay.
What it started with me being short-winded, and that's where it started. And then I went to the doctor, went to the hospital.
Was that back in the fall?
No, that was April the
April
8th.
of this year. Okay.
8th. But when you went on the 23rd, it was a different kind of weakness, right? Or the same?
It's the same.
So November the 23rd.
November wasn't anything about this cancer situation. This was about the in November. This was about the diabetes.
Yeah, but when you went to the doctor, you felt weak.
Oh yeah.
You didn't have no pain in your chest, right?
No, I just
Okay.
felt weak
You just felt
weak and thirsty. I couldn't get enough water.
Okay.
And what made them do a chest X-ray to see the spot on your lung in November?
Well, Dr. Rose had seen it before,
Okay.
and he wanted to check it to see if it had.
To change.
Changed.
See if it changed.
Right.
Okay.
Hmm.
It had increased, and certainly increased from November until April. It got bigger.
Right.
Okay, so how is the short-winded feeling now that you were having last month? Has that improved or it's still there?
It's still there.
Okay. What makes it better or worse?
If I walk
If you walk,
a distance,
it makes it worse?
makes
Okay.
it worse.
What about what makes it better? Other than stopping walking, do you have to take a pain pill to make it better? Or if you just stop walking, does that make it better?
Well, I stop walking, that makes that breathing better.
Mm-hmm.
I take the pain pill for the pain in the back.
Mm-hmm.
And he's taking them 4 hours on the dot.
He takes the pain pill every 4 hours. If you miss it, what happens?
I don't know because I haven't missed
Well, I'll tell you how I know it's 4 hours. They make him sleepy, and like if I'm up, and it's like 1 o'clock in the morning, I says, well, I just wait till 3 o'clock because he's going to wake up, and he does.
Okay.
It's exactly 4 hours.
Okay.
And while we're on the subject, the emergency room doctor prescribed oxycodone, and then when a couple of days later, when we saw Dr. Rhodes, he changed it to hydrocodone.
Okay.
And we were both taking that because we were both in the motor vehicle accident, and that bricked us up then. And he's been having a terrible time. So the past couple of days, he switched back to the oxycodone that he had left over from the emergency room visit.
And that's working?
and that one works without all the
Constipation.
in his whatnot.
So the oxycodone is better from you for a bowel standpoint. Does it have Tylenol in it, this oxycodone?
Let me get it out.
Percocet is good for short, like it lasts 4 hours, and it's giving you good relief.
It's giving me good relief.
Okay. If you're on, there's a longer acting form of Percocet called oxycodone, OxyContin, and the only downside to OxyContin is that it's not generic. So I don't know what your prescription copay is.
Mm-hmm.
Do you know what your prescription copay is for non-generics?
We just had to see if his job, he doesn't have copay. He just has a monetary limit every year.
Oh, you're only allowed to spend so much per year on medication?
Yeah, whatever
and after
it is.
that, you have to pay cash for
After
everything?
that, I have to pay for it.
So OxyContin's not going to be the best choice, I don't think, because we're still early in the year, and I think if you don't know what that limited, it's probably like $5,000 though, right? It's probably something like $5,000 or something.
No, it's less than that.
Less than that even.
But
Okay.
let's go with it. I would want to try it, and let's not worry about that.
Okay, but it runs into hundreds of dollars per month. I'm warning you. So there are maybe other medications that we can use if if there are other medicines. It's just because the oxycodone seems to work. I wanted to look for something that made sense that would work. But
Okay.
it may be that there's another formulation called MS-Contin or morphine, which is like the OxyContin. Do you have trouble with morphine? Have you ever taken morphine when you were injured before?
We took.
No.
We didn't.
No.
We didn't take morphine.
No.
They didn't give it to you intravenously in the hospital?
No.
Okay. 'Cause
Yes, they did.
You had it?
Yeah. Uh-huh.
well, if he had a pelvis fracture, I'm thinking.
Yeah.
Oh,
Yeah.
okay.
Yeah. I had it.
I don't know what he
In
had.
the hospital, I had it.
I don't
yes.
know what he
I'm
had.
thinking he might have. Yeah.
Yes.
Yeah.
That's pretty bad stuff, pelvis fractures.
Yeah.
So anyway, so I can give you morphine comes the same as oxycodone, and then is the short acting, and morphine is the short acting, and then there's OxyContin, which is the long acting of this, and there's MS-Contin, which is the long acting of morphine. And so we could try the MS-Contin and see. It should be less expensive because it is available generically. And I would start you with 15 milligrams of that twice a day, and see how you do with that, and see if it reduces the amount of this that you have to take, and more importantly, if it gives you that pain control so you're not waking up every 4 hours to have to get a pill. The way that oxycodone is, it only lasts 4 to 6 hours, and that's not going to change.
Mm-hmm.
So you have to do is put it into an extended release tablet so that it will spill out over time and give you that extended management. So if you're taking one every 4 hours, you're taking 6 a day. So if I give you MS content,
Yeah. What is that?
so you're gonna take the morphine MS content in the morning and in the evening about 12 hours apart.
Okay.
And then if you have pain in between times, you can take one of these or a half of one.
Okay.
Yeah.
Okay, that sounds.
Yeah, because he's really not a pill person. He hates it.
Okay.
So if he
Yeah.
can cut down, he'll feel much better.
And the other thing you need to do is if you start to find that you're getting bound up from this, you may want to purchase a medicine that they sell over the counter now called Miralax
Yeah.
and
Yeah.
use that once a day. It'll help to keep your bowels moving.
All right.
Okay?
Okay.
Okay.
So whatchamacallit, when I went for the colonoscopy, they gave me a sample of it,
Okay.
Miralax.
Well, if you have it at home to sample, then you could try that and see how it works. But that should be.
So he takes his pills, his diabetes pills and all of that stuff,
Mm-hmm.
and how does he integrate it in with the pain pills and the Miralax? Of course, if you take the Miralax, that's going to wash everything out of you, even your pills.
No, it won't. It won't. No, it doesn't work that quickly. It's not that quick. If you just take it once a day, it won't work that quickly.
Well, I mean, so what should his sequence be?
None of these medicines interact. He takes, what is the 80 milligrams that he takes? Uloric? Is that the medicine? Was it
Right.
U? So this is gout
Right.
medicine. And but this is the same as the allopurinol, isn't it?
Oh,
Yeah. Looks like you guys have to have a conversation with Dr. Rhodes. Is he on the allopurinol every day? Is he taking it every day?
Yes.
And you just take Lantus for the diabetes, right? Do you take any
One.
other pills? No, that's it.
yeah.
That's it.
And this is, this is the allopurinol, yeah. So this is the gout
That's-
pill.
that's for the
And
gout.
this is supposed to also be for gout. But if this
Right.
is controlling it, why do you need this?
Well, he told me not to take this one
Until he checked your liver.
until he use this one up and check my liver.
Oh, because he needed for your liver to be okay till you started that one.
Right.
I see, okay. Have you started that one?
I had started it. He took me off it and put me on the Urlic
Uh-huh. Just, yeah.
to use that
Okay.
until
Oh,
he
so you're
checked.
not taking this.
But then we got off track because of all this other stuff happening.
So how is your
Yeah.
gout?
But gout is,
Oh,
yeah,
you know, this is the first I'm hearing a lot of things.
what? The
You
gout,
know? No, I mean, I'm hearing a whole lot of things for the first time.
yeah. The gout it's under control.
Oh.
The gout's under control.
Okay.
Because when it hits you hard.
Mm.
Got a Joe Louis.
Yeah.
Gout does? Okay. So I would say, the thing about it is allopurinol is something that you really shouldn't start and stop and start and stop. You need to go ahead and start it. When you start it, sometimes it can make the gout flare. But I'd rather you be on it before we start all this.
All right.
I'd rather you be on it before we start all this. Now, so I would go ahead and start it this week and make sure that the gout doesn't flare. Go ahead and start taking those allopurinol tablets.
What about
Okay.
the Uloric?
I would leave that off.
Okay.
Leave that one off.
Okay.
Just take
Yeah,
that.
those are samples anyway. I can guarantee you if you went to the pharmacy and tried to buy that,
Yeah.
I didn't want to know how much. You could ask the pharmacist how much it is, but I have a feeling it would be a ton. I have a feeling it would be a lot of money, especially if we're trying to help your dollars to stretch and then see if we can get you some assistance if that's the case, trying to get some medications for you. But Uloric, I think, would eat into it pretty good. So we don't need to. I don't think it's going to give you any better benefit. If I thought it was better, fine. But I don't think it's going to give you any better benefit than the allopurinol. I don't think. Is Dr. Ensley back? Or Dr. Rhodes is your doctor?
Dr.
Yeah,
Rosen.
he's back.
Okay, Dr. Rhodes is back.
He's back, yes. I got to see him on the 21st and 22nd.
You'll see him on the
20,
22nd of May?
wait, I really think it's at the end of the month that you're going to be seeing him.
Yeah, I
Hold
know
on.
it's,
Let me,
I know.
When you take aspirin.
hmm.
I was in the military and I took aspirin.
Mm-hmm. Right pain. How bad is it on a scale of 1 to 10?
I'd say maybe 4.
A 4?
About a 4.
And how bad is it when you have to take the pain pills? Is that what it is, a 4, or is it like, I mean, how bad? What's the worst it gets?
The worst it gets, maybe a 6 or a 7 is the
Compared
worst
to the
it
pain you had when you had your fractures?
Right.
No.
But what happened is if I'm still, it doesn't bother me. Like now, I don't even feel it. But if I try to get up, that's when it's painful.
Okay, so when you're changing position, you feel it. Okay.
Right.
Okay, and most of the pain that you're having is in your right hip?
It's in the right hip and in the back.
Where in your back?
Right in between the shoulder blades.
Okay. Okay. Okay, that's good to know. Okay. Let's see some order. Okay, great. Let me see. I don't typically do them routinely, but
Okay, I mean, it was something that was talked about, not talked about, you have an order here for,
you have, okay.
you have it?
Oh, MRI brain. Oh, they've ordered it already.
No.
They did no. Oh, they want us to do
They
it.
ordered it, and the cancer said it wasn't doing them this week.
No, that was mine. That was my scan. I was supposed to have a bone scan.
Yeah, they ordered the MRI. Mm-hmm. Well, they suggested that we do it. I'm happy to put the order in. We discussed it. I discussed it with John Carey. I did discuss it with him. So
right.
it's one of those things that if you're not having any symptoms, I don't typically do them, but we can order an MRI of your brain. I think more worrisome to me is your shoulders. So I'd like to get an MRI of your spine, your thoracic spine.
Okay.
But I'm happy to do one of your brain just to make sure that that's clear to start. That's fine. Yeah, so there's no surprises. Easy enough.
Well, I mean, can they be done at the same time?
We can ask. We can ask.
Of course, you know.
We can ask.
What, is the machine open or closed?
What?
It's not an
Yeah.
open MRI. It's not open. It's
Closed.
they're better than they were, but it's not an open MRI.
And so he would have to go in for the back and then again for the brain?
Yeah, you can't do them all in one pass because they're separate
So-
parts of the body, and they
Yeah.
have to set the machine up differently. So it would be a long day if he went for both of them. I'd rather get the MRI of the spine first, and
Okay.
the MRI of the brain in a week or two, just to have it.
Okay.
But I think let's do that.
Okay, let's do that.
I want to
think
do
that'd be better.
I want to do the MRI of the spine, but I need to examine him anyway, so I can do that.
Mm.
The recommendation. You excited?
Oh, talking about chemotherapy, here we go again with the cancer guide that I got from the pulmonary clinic. This stuff called Chemo Fix. They said that they could put this stuff on the biopsy material, and you know, before you go undergo the chemotherapy, you can see if it's going to agree with you. Or, you know, maybe they shouldn't put stuff like that in books for the public.
This is an advertisement for a company that makes this product.
Yeah.
And I would say that most physicians don't routinely use them.
Right.
Because what they're doing is they're taking the tumor that they biopsied, and they only had a small amount because they got it from their bone, but they're taking the tumor and they're running it through an assay to see how it would metabolize certain drugs, but how it does it on that test and how it does it in real life may not always be consistent. We can certainly look into it if that's something that you want to pursue, but it's not been found to be, I think, in most academic centers and most places where they do a lot of the research, they haven't found these to be as effective in coming up with helpful treatments.
Okay.
But it's something we could think about. It's not something I usually do, but I can certainly look into it with you. Chemo FX.
Oh, you know,
I know.
they have these books and you see stuff in there, but in real life, you know,
What it is,
you
yeah.
you know.
My recommendation would be that the standard treatment, you have what's considered to be adenocarcinoma of the lung, and it's considered to be stage 4. Do you want me to write that down?
No,
You know
you
that.
already told.
We
Considered to be stage 4. The standard treatment for that would be a drug called Avastin and 2 drugs called Taxol and Carbo in combination intravenously. And so the Avastin is not a chemotherapy per se, it's a protein that helps affect how the blood vessels are formed that supply the cancer. So it kind of prunes them back, is the theory of how it works, is that the idea of how it works is it prunes the blood vessels back so that it starves the cancer. It can't get the blood supply that it needs. And the chemotherapy, the Taxol and Carbo, work the way any of the old standard chemotherapies do, where they attack dividing cells and cause them to make mistakes that prove fatal. So in that way, they cause the cancer cells to basically necrose or die and
go in remission anyway.
go into a remission. Exactly. Try to get your pain under control and go into a remission. So
Is it something you drink or you're
it's an
radiated?
intravenous. You get intravenous. You get in, how are your veins, by the way? Pretty good? They should be good.
Well, they fair.
The fair?
Yeah, they used to be good.
They used to be real good, but I don't know why they look like they shrunk or something. I don't know. But they used to sit way up.
Mm-hmm.
Well, you used to be real physical.
Yeah, if you had more muscle than
Yeah,
your veins.
he used to be, a mechanic,
Mhm.
and they were very strong.
You're also 83. Yeah. You're not gonna have the muscles of a 25-year-old when you're 83, right? You're in pretty good shape, it looks like. So, yeah. But let's be reasonable. You're 83. You're not gonna have like.
I'm not going to have the bulges anymore.
No.
They're gone.
They're gone. Sorry.
Well, you got out of the bowling alley when you climbing in and out of machines, and you went in the office with the police department, sitting down.
Yep.
That's when he put on some
Oh,
pounds.
wait.
When I met him, he was skinny guy.
How long have you been married? How long have you known each other?
33 years.
33.
Yeah.
Good. Okay, this is through. So, port. Do you want a port for IV? We can either give you an IV when you come in here and see how you do, or we can put a port underneath of your skin that we can access, and that way you don't need to get the IVs. It just depends on how your veins are.
Oh.
We can start with the one, and then if we decide we need to, we can switch to the other.
Okay.
Want us to just start with plain IVs? Okay, that would be my preference, but
Yeah, start with that.
okay. And we're going to get the MRI of your T-spine. I need to examine you. You want to start next week?
Yes, as soon as
Let's
possible.
see what we got on. I mean, your priority. That's what happened today. I called yesterday and canceled because he was supposed to get a portable oxygen thing, and then after I had changed the appointment, like he was sleeping when I changed it, and then when he woke up, he says, "I feel awful." I said, and then by the time I called, the office was closed. I'm so glad you were able to see him.
Oh, I'm sorry that the wait is so long. I had to stop
Oh,
at
it
a
was
hospital.
no
so.
problem. Just glad you could see him.
It's nice that you have that paper card. It worked well. Yes?
Dr. Staley's online one for you.
Can I take this call? I'll be right back.
Sure.
Thank you. This is stage 4. It's in the bones, and it's only in the bones. The liver looks spared. The rest of the lungs look spared. I think that we can tackle this, and I think we can give you a good response. The standard chemotherapy that you would give for an adenocarcinoma of the lung, which is what this is diagnosed as, would be to give 2 drugs called Taxol and Carbo intravenously. And recently, well, not that recently now, it's been about 4 years, it was found that adding a drug called Avastin can further benefit and improve the response seen with those 2 drugs alone by adding this third drug, which is not a chemotherapy per se, but rather a protein that works to affect blood vessel development. And so with this combination, we're able to see better results and get patients get their cancer under control, and hopefully even get them into remissions. There's no guarantees in this game. I can promise you that. That's the one thing I can guarantee you, is that there will be surprises along the way.
Right.
Some of them good and some of them unfortunate. So, but we will do what we can to try to get your pain under control. That's my first priority, is getting your pain under control and getting your cancer under control. And I think they actually go kind of hand in hand. If you get the cancer under control, we should get your pain under better control too. The intravenous chemotherapy, the Avastin, I'll tell you about first. Its main side effects are it can affect your blood pressure, it can affect your kidney function, and it can cause you to spill protein in your urine, and it can increase your risk of developing a blood clot. So, we'll monitor your blood pressure. We'll ask you to give us a urine specimen every time so that we can dip it and make sure that there's no protein or not an excess amount of protein in your urine. And you're going to need to stay somewhat active during the day. Keep doing exactly what you're telling me you're doing. Get out, move around, don't be sedentary for too long. Because all of those things will prevent blood clots.
Right.
The Taxol and the Carbo, those are the straight chemotherapies. The Taxol has the potential to cause an allergic reaction